Would you like to avoid a C-section? Because if you would, then you need to make sure that you don't fall into any of the cesarean traps. What is a cesarean trap? These are the things that basically undermine your confidence, lead to unnecessary interventions and C-sections, and sabotage your physiological birth process. Hi, my name is Carly Bonderud, and this is the Empowered Birth series where I go deep into everything that you need to know to plan and get your empowered true natural birth. And if you've been following me for a while, then you already know we are going into the deep dive master classes. And now we're going into the 21 cesarean traps. So if you watched the previous video where I talked more about the cesarean traps, then you already know that we have a cesarean epidemic in our society. And moms think that all these C-sections were life-saving, when the truth is that oftentimes they are being tricked into having a C-section, sabotaged of their natural birth, undermined of their confidence that they could ever have birthed their baby naturally. And ultimately, this then leads to moms who had one or more C-sections being told, you're not allowed to have a natural birth. And then the VBAC moms get screwed over. If you also watched that video that I did, then you know about Dee Dee's story and about Jenny's story and about Rebecca's story. The clients that came to me who have basically said, if I had never found you, I would have had another C-section, or I wouldn't have even tried to have a natural birth. And the fact is that that's not true. They fought for their natural births. They had to. And I want to make sure that you don't have to fight, beg, or compromise. So yes, I've worked with these moms who have been able to go on and have completely natural births after being told that they weren't allowed. I have worked with moms who were told that they couldn't have a VBAC only to succeed in having a VBAC, and moms who've had multiple cesareans and still had a VBAC. And the thing is that there's a difference between true natural birth and natural birth perpetuated by the medical system that leads into these cesarean traps. Go check out my starter guide or the Natural Birth Traps series to understand more about the difference between true natural birth and natural birth in the medical system, because cesarean traps build on the natural birth traps. If you've read my book, Your Empowered Birth, then you already know. In chapter 1, I talked about the composite character of Kate. Kate was a first-time mom, and she thought she was doing everything right. She read the books. She also had the doula. She hired the midwife. She planned a home birth, but in the end, Kate got tricked. She was told that she wasn't dilating. She wasn't going into labor on her own. She had an induction, and that led to her not dilating and getting a C-section. And she's like, what happened? Is it that my body was broken? No. Kate fell into those natural birth traps. Now, the thing is that Kate has two different choices. Kate can decide that she can never have a natural birth and accepts that she just ended up having a C-section and that her body is broken, and allow the cultural narrative to continue to gaslight her. Or Kate can start to question things. Kate can be like, I was taught what to think, not how to think, and follow the empowered birth method. And that is what this deep dive masterclass is really all about, is helping you to plan and get your empowered true natural birth. Now, every single series starts off in the same way. I tell you the list of those natural birth traps so that you get the overview. There is also a list on my website at empoweringmomsbirth.com/freebies. So you can go and check that out. You can also go and check the description of this video and see if there's a transcript already available. Sometimes it takes a little while. Our software doesn't always like to transcribe for us. And really what we're focused on is getting the deep dive masterclass out first. Then we add the extras. The deeper you go with empowering moms, the more treasures you uncover. And we are constantly improving and adding resources to our resource library for moms. We have an empowered birth toolkit. We have self-study programs available where all you put in is a name and email. Sometimes you can just check the playlist of our YouTube channel and you'll get some deep dive training. We also have premium coaching and that path is not accessible to everyone. It's a steep price tag to work with us. We're worth every penny. We 10x your results. We accelerate your transformation. We allow you to get the birth you want without having to fight, beg, or compromise and get the fast track. However, at the same time, I'm very protective of my energy and I'm protective of the energy of my coaching queens. So we want to make sure that those calls and those programs go to the moms who need it most, who are investing their time and their energy and their money into that, and they're going to go and get those results. Otherwise, we direct them to self-study, and we also have a self-study VIP option if you want a little bit of additional hand-holding, but you're not in the deep, intimate container of our premium coaching. You can again learn more about this if you go to my website, empoweringmomsbirth.com/start guide. Finally, I want you to treat these masterclasses as if you had paid for them, at least $97. You plunked it down and you're sitting for about, say 30 minutes to about an hour. Sometimes they go a little longer. The deeper the masterclass needs to be, the longer it's going to be. So it may be 90 minutes. So prepare to be able to take notes. If you are choosing the do-it-yourself path, which is what these masterclasses are basically for, and they're also supplemental education for our self-study students and our premium coaching moms, then what you're going to want to do is watch the video at least 3 times. First, you're going to get the overview. You'll know what's in it. You watch it from beginning to end. The second time you watch it, you're going to want to sift through again, beginning to end, for those aha moments. Third time, you can just bounce around to where you really want to go to apply the empowered birth method. You pretty much figured things out. And then once you do that, you want to implement. Because again, I'm committed to you having an empowered birth, whether you work with me directly or not, whether you could ever get my book or my coaching programs or my self-study programs. I do have self-study VIP. There is a program called Your Empowered Birth Academy. If you sign up for the Empowered Birth Toolkit, you will get a whole bunch of workbooks that also come with Academy. But Academy, as I said, information is free. I only charge for access to me. That means that you're really just paying for the extra support, not the program itself. Because even if you watch these deep dive masterclasses, you will still get the secrets that come with Academy in the core program. You just don't get access to me and my coaching queens because, again, we are focused on getting those moms who are investing in themselves to that next level. We want you to have that transformation. We will do everything in our power to give you the quality information that you need to get that transformation at any level. Because I am committed to you having an empowered birth. When you have an empowered birth, you're an empowered mom for life, and no one can take your power away from you again. And as I've been working with my clients and working with my friends, I recognized just how much this information is needed because I heard the devastation in their voices. I watched as they'd fall apart and be like, I can't seem to get anybody to support my VBAC. So I want to help you avoid that primary C-section, or if you've already had one or more, to be able to take your power back. You deserve it. Even if you end up getting a C-section, I want it to be your choice, and I want you to make it from a place of power instead of a place of fear. So if you follow along what I'm going to be teaching you, I'm going to give you that overview of the 21 cesarean traps that you want to avoid. I will also tell you about additional resources you may want to check out. And remember, I'm going to go deeper into every single one of these 21 things. So this is the start of season 3 of the Empowered Birth series, where I go deep into everything you need to know to plan and get your empowered true natural birth, the cesarean traps. And all I ask is that if you find value in this video, please like, share, subscribe to our channel, pay it forward, pass this on. Give this to other moms in the mom groups, especially the VBAC moms, especially the ones trying to avoid a C-section, because I am committed to everyone having an empowered birth. Every birth can and should be a beautiful and empowering experience. and you are not disposable. So now let's dive into those 21 cesarean traps. So number one on our list is the big baby. Oftentimes, OBs will say at 35 weeks, when it's too late for you to really change care providers, your baby is getting big. We may need to schedule a C-section. They may also just say that they're going to schedule an induction and then push you into a C-section. Either way, they are undermining your confidence. Now, I do have another video inside of the Natural Birth Traps series that basically addresses growth scans. You may want to check that one out. I also have addressed this a lot with induction. Big baby is one of the big induction traps. Every time I see this in the mom groups, I'm like, red alert, red alert. They are trying to push you into a C-section. There's no evidence for it. In fact, Rebecca Decker herself has said this. So if you have your care provider saying to you that you're having a big baby and that you might need to schedule a C-section, really, really question that. You may just be falling into a trap. The next one on our list is number 2, small baby. This is the other side of the growth scans, and this is where I almost got tricked. Basically, your care provider will tell you that your baby is too small for dates. Then they will also suggest that either you induce or plan a C-section to get baby out early so that baby can thrive on the outside. There is a huge, huge difference between small for gestational age and true growth restriction. Now, if your baby has a true growth restriction and your baby is not thriving, then absolutely scheduling a C-section is probably going to be a safer route for you and your baby than scheduling an induction. Rachel Reed talks about this inside of her book, Why Induction Matters. So you may want to check out that data, because this is where I got tricked. They told me that my baby was growth restricted when really he was just small for gestational age. And that ultrasound turned out to be completely wrong because my baby came out almost 8 pounds at 41 weeks. So be very careful about that, because if you schedule a C-section for a small baby and it turns out that they just needed more time to grow, then you have prematurely taken that baby out before they were ready for the outside. And that in itself is devastating, to find out that you actually didn't have to have a C-section and that your baby had some complications because of it. Number 3 on our list is the high risk label. Often moms are told, because you're high risk, we're going to induce you. Because you're high risk, we're going to give you a C-section. Because you're high risk, you're probably not going to be able to have a natural birth. And this then reinforces the idea that the mom is not able to birth effectively on her own. But you know what? Jenny already debunked that myth because she was the epitome of the high-risk mom. Previous history of preeclampsia after she had her first baby. She had a pre-existing condition of chronic high blood pressure. She had gestational diabetes. She even was GBS positive, and she was 41 years old. And yet she still ends up having an unassisted VBAC in the hospital. Now you're trying to tell me high-risk moms can't give birth completely naturally? Well, I don't buy that because I didn't know just how powerful the empowered birth method was until Jenny implemented the system. Because I'm like, Jenny is like the high-risk mom, and she has all of these possibilities of what could go wrong. She has a 15% chance of success of having a VBAC, and she did it. Well, if that's the case, then you need to recognize that the high-risk label could just be restricting you unnecessarily. You want to check out one of my other videos where I talk about assessing risk. This is inside of the Empowered Birth Series Season 1, which is the 26 things that you need to know if this is your first time planning a true natural birth in assessing risk, Birth Advocacy 101. Go check that one out. Next on our list is number 4, twins. How many times do you hear that because you have twins or somebody has twins, you have to schedule a C-section? Well, the truth is that I have seen twins being born at home in the water, even unassisted. There's been moms who have had VBACs with twins, and they weren't planning to. They just ended up giving birth on the side of the highway on the way to the hospital. So if moms who have surprise twins, or they end up having twins that they were planning to have a C-section and they still do it naturally, then why is it that we suddenly force moms who have twins into surgery? Well, again, it's profit, convenience, liability concerns, and fear of natural birth. But if you are having twins, there are moms that have had twins naturally at home. You don't have to schedule a C-section. Again, with the empowered birth method, we aim for a true natural birth and we create our backup plans. So if you do feel that it's safer for you to have a C-section and you've done all your research and you're coming to this from a place of power, that is completely different than feeling like you have no options. In that same vein, we have number 5, which is breech. Again, a lot of moms who find out that their baby is breech get pushed into a C-section, or they're told that because the external cephalic version doesn't work, the ECV, that they automatically have to have a C-section. And this is, again, not true. You know, if more moms fought for a breech vaginal birth and stopped being afraid of it, we would have breech vaginal birth again. But because of the fact that there was a huge, huge campaign and there was a breech trial that has since been debunked, we now have stopped allowing care providers to have those skills, or we're restricting the ones who have those skills from practicing. There's a lot of midwives and even doctors who would love to attend a vaginal breech birth, but because of the way that the system is set up, they're basically not allowed to do that, and their hands are tied. The way to change the system, though, is supply and demand. So if you demand it, they will have to start supplying it. So recognize that there are resources that you can go and check out to get information on breech. Coalition for Breech Birth and Breech Without Borders are 2 that I would highly recommend. Haley Pierce also has a book called Breech, and it's got a whole bunch of positive birth stories on breech babies. So I would suggest you check that out. And remember, breech is just a variation of normal. Finally, I also did an interview with a mom who has her own business, Mom Elevated, and she basically had a breech birth because she did not want to have a C-section. So you can check out that interview as well. Number 6 on our list is the scheduled C-section just in case. Oh, we'll schedule your C-section for 39 weeks just in case you don't go into labor on your own. We'll schedule your 39-week C-section just in case you can't have the VBAC, just to get it on the books. Usually this is done with VBAC moms, but it's also done with moms who have the high risk label placed on them. And, you know, the thing is that if you schedule a C-section for 39 weeks, they're setting you up to fail. They tried to do this with my client, Dee Dee, and Dee Dee knew better than that. She's like, I'm not likely to go into labor before 39 weeks. I'm like, no, probably not. She's like, well, I'm going to reschedule this for 42 weeks just to get them off my case. I'm like, that's probably a better bet because they're trying to get it so that you don't go into labor on your own. This isn't a just in case C-section so that you have it on the books if you need it. This is a let's sabotage you and get you onto the books so that we can cut you open. And we're going to do it before you can possibly go into labor. Don't fall into this trap. If your care provider is like, let's schedule a C-section just in case, you can be like, yeah, that's nice. We're not doing that. Number 7 on our list is failure to progress. This is where a lot of primary C-sections happen and VBACs as well. This is failure to wait. Your body needs time to open. Your body needs to feel safe to open up. And a lot of things that are done in the medical system that sabotage natural birth make it so that you end up failing to progress. But the truth is that if they gave you more time, if they supported physiological birth, there would be far less C-sections happening for failure to progress. Go check out some of my videos within the Natural Birth Traps series. You may also want to check out the 26 things that you need to know if this is your first time planning a true natural birth and learn more about getting the right care provider to support you. Because the truth is that birth often is being perpetuated as this dangerous thing and natural birth is not being supported. So if it's not being supported in the hospital and they are doing things to you, then they can't see the water they're swimming in. And then they say, oh, it's failure to progress. And that's your body that's the problem, when really it's the environment that you're in. And this is why number 8, not dilating at least 1 centimeter per hour is also terrible, terrible advice. because the fact is that your cervix could go from 0 all the way to 10 within an hour. You could also steadily progress and not go 1 centimeter per hour. The fact is that labor is not a linear process like the medical system likes to think it is. And the idea of dilating 1 centimeter per hour is actually based on a physician way back in the 1950s, a male physician at that, who had basically decided that moms need to dilate 1 centimeter per hour. All of his clients were on Pitocin when he made this up. And it was basically the study being done within his practice, Friedman's curve, which is what a lot of doctors are basing this on. And because of that, dilation is not the same thing as your body being ready to birth. So we need to get over this dilation-centric culture where they check your cervix and they're like, you're not dilated, so you're not progressing, so we have to do a C-section. The thing is that when you let birth unfold the way it needs to unfold, it can unfold in a myriad of different ways. Go check out Rachel Reed's book, Reclaiming Childbirth as a Rite of Passage, to learn more about that. I also have a deeper module inside of Your Empowered Birth Workshop, which is my self-study free program. You just put in a name and email and sign up for that. And it tells you more about physiological birth so that you can really understand this. Number 9 is taking more than 12 hours to birth your baby when you're in labor, because again, this is another really stupid thing that the medical system and our birth culture has perpetuated. In fact, it is so prevalent that it is often seen in movies, it is seen in TV shows, and it is even in books. In fact, there was a throwaway chapter inside of 50 Shades Freed where I was reading at the end, and they really say, Mrs. Gray, you've been in labor for 12 hours, and the Pitocin is not working, and now we need to do a C-section. And I'm sitting there, and I'm screaming at the book and being like, what the hell do you think you're doing? 12 hours? Are you kidding me? Because the fact is that labor is not linear, first of all, and you really don't want to be in the hospital for 12 hours. I suggest to all of my clients, go in at the last possible minute. The labor and delivery ward is not set up for a physiological birth. They're designed to fill beds and empty beds. It's not lucrative and it's not sustainable for them to have moms have physiological births. They need you to move along. So if you stay out of the hospital, then that allows your body to progress the way it needs to, because dilation happens in its own time. Birth happens in its own time. Go in at the last possible minute, and you won't fall into the trap of laboring for 12 hours plus and not progressing in the hospital, because there's so many things that can factor into that. If you don't feel safe to birth there, you're not going to dilate fast enough. That also leads to number 10, which is what happened to another client of mine, Lisa, restricting food and drink. You know, your body needs to have that fuel in order to keep going. And I noticed myself, even in my own labor with my daughter, that when I hadn't eaten for several hours, my labor started to slow down. It even shut down completely. If I'd been in the hospital, that would have been failure to progress. But because I was at home, I said, I'm sending the midwife home. I'm going to have a hamburger. I'm going to get some sleep. And wouldn't you know it, I got back into labor. So go and check out one of my videos in the Natural Birth Traps series on restricting food and drink to learn more about this. But the fact is that when they do this, they're setting you up to fail again. As are they doing this with number 11, external fetal monitoring and internal fetal monitoring. When they are doing continuous fetal monitoring, you are actually more likely to end up in a C-section. First of all, for external, they can't find the baby's heart rate, or they get a false positive that says that the baby is in distress when they're not. They're more likely to just wheel you in for a C-section. If, however, they can't find the baby and they decide to use the internal fetal monitor and screw something into the baby's head, then what this does is it can also lead to infection because they have broken the bag of waters to be able to do that. And now you're also leading to having that uterine infection that then leads to you needing to have a C-section. Be very, very cautious before you agree to fetal monitoring. Again, I talked about this deeper inside of the natural birth traps, so you can go and check that video out inside of the playlist. Number 12 is breaking your waters. You see, your amniotic sac has an actual purpose to it. It is to keep the baby nice and protected so that there's no infections happening. It's also to allow your baby to float so that your baby can turn into a good position. It allows the placenta and the cord to be protected from the force of the contractions. It's a squishy water balloon that helps to equalize the pressure of those contractions. Now, if they break that squishy water balloon and it wasn't meant to break yet, then what this does is it screws up your physiological birth process. It makes it so that you're having more painful contractions. It puts your baby in an awkward position that they may not have been ready for. It can compress the cord, and you can also have cord prolapse, which means that the cord slips through before the baby. And if that happens, that is an absolute emergency. Do not let them break your waters. I'm telling you this because I have seen what happens. Christine herself had her waters broken, and suddenly the monitors went crazy and there were immediate decels, and her baby was in distress. And because she had also been induced, she had high-level Pitocin contractions that were making it even harder for her baby. She had the C-section partly because of the induction and also because they broke her waters, and the baby wasn't in a good position for that. So be very, very careful of anybody who wants to break your waters. Number 13, Pitocin. There is something called pit to distress. And a lot of care providers, especially category 5s, will just keep cranking up that Pitocin until either the baby comes out or you end up needing a C-section. Pitocin is not the same thing as oxytocin. Pitocin causes your uterus to hyperstimulate. Pitocin squeezes your baby, there's no biofeedback happening, and then that can lead to stronger contractions than was otherwise going to happen. Too many moms have had Pitocin only to end up having a C-section. And if you have Pitocin, you are no longer having a physiological birth. You don't know how that's going to be for you. Go check out Rachel Reed's book, Reclaiming Childbirth as a Rite of Passage, for more on this. And inside of my Natural Birth Traps series, I actually talk about Pitocin. It is also number 13 on the list for the Natural Birth Traps. Number 14 on the list is birthing on your back. You see, your pelvic outlet is narrowed when you are birthing on your back, and this also leads to babies getting stuck. This is then when the moms are basically told, you are not able to push your baby out, so we have to give you a C-section. You have a small pelvis. That's why the baby got stuck. Instead of recognizing that maybe they should stop putting moms on their back. And yet 99% of births in the hospital happen with moms on their back. Now, I do have another video inside of the Natural Birth Traps series on birthing on your back. So you may want to check that out as well. But the fact is that get off your back if you want to avoid a C-section. Because I was laying there on the bed realizing just how hard it was to push my baby out while I was flat on my back. And I was trying so hard to beat that clock because I knew that I was almost 3 hours in. They were going to call a C-section. I managed to get that baby out, but so many moms are not that lucky. So get off your back. Not only that, this can also cause it so that your baby is stuck, literally stuck. And, you know, we don't want to do anything that's going to screw up our birth physiology. It's also painful. So stay off your back. Number 15 is a previous C-section. If you are trying to have a VBAC, you have a lot more that you are trying to dodge here. If you've had a C-section, then the medical system basically thinks that you failed to progress, or your pelvis was too small, or you don't birth effectively, you don't dilate, and you have trauma from that. You have trauma, And you also are wondering, am I even going to be able to do this? On top of that, there is a lot of fear around VBAC. There shouldn't be, and there is. And there are resources that you can go and check out. I highly suggest you learn from Jen Camel of VBAC Facts. She is the one that I send all of my clients to for VBAC information. The truth is that if you don't schedule surgery, you will either have one of two things happen. Either you will birth your baby naturally, or what's going to happen is you're going to recognize that maybe you need to call in that C-section, and it will be your choice, not the medical system's. So don't let anybody tell you that you can't have a VBAC, because that is probably the worst thing that can happen, is that after you've had a C-section, everybody is telling you to just schedule another C-section. Just because your birth went wrong the first time, or just because you got tricked out of your natural birth, or even that you had complications with the first pregnancy that warranted you to actually have a C-section. I mean, there are things that sometimes you have placenta previa or vasa previa or placenta accreta. Those are reasons to have a C-section. A transverse baby, absolutely. If a transverse baby isn't going to move, then that is a reason for a C-section. But we don't automatically default to the C-section. We need to stop treating this as if it's a catch-all, save-all, better way of giving birth, because it's not. It causes lots of complications. Even with an uncomplicated C-section, Christine ended up with dense adhesions. That meant that her organs were also kind of dealing with the scar tissue from her cesarean. And that's not okay. We shouldn't have to go through major abdominal surgery if we can avoid it. So if you have had a previous C-section, let me just tell you, there are resources here at Empowering Moms, and I have additional resources through my Empowered Mom Circle that will help you to have your VBAC. Just reach out. In the same vein, number 16, if you've had multiple C-sections, you're even more likely to be discouraged from having a VBAC, because now you've had multiple times where you have been tricked out of your natural birth, or you were basically told that you didn't even have any options and you scheduled that C-section without knowing. Let me just tell you two stories here. So the first time I learned that multiple cesareans do not mean C-sections forever was after I decided to become a rally coordinator with Christine. In 2014, I stood outside and I had my signs, and a woman came up to us. Her name was Wendy. Wendy had 4 kids. Her 4th one was the same age as mine and Christine's babies. So she had basically come to us and she'd seen our rally coordinator page and she wanted to support us because Wendy had basically fought to have her VBAC after 3 cesareans. She'd come up to us and she's like, I had a VBAC over the summer. And we're like, oh, do tell. And she's like, I basically fought for my right to have my VBAC. I'm like, really? And she's like, yep. I made sure that I had all of my options, but they weren't going to give them to me. I had to fight for them. Nobody in our health authority was going to allow me to even try. I had to drive an hour to get to another hospital to be able to have my VBAC. And even then, I almost didn't get it because they pretty much canceled my whole appointment and said, no, I was going to have a C-section. This is what her doctor actually did. They said, no, she's going to have a C-section. And Wendy was not going to have a C-section. So when she showed up at the hospital, they were surprised to see her. They're like, I thought you were scheduling a C-section. She's like, no. Who told you that? It's like, well, your doctor told us that. It's like, oh, okay. Okay, well, no, I'm not going to do that. So she ended up becoming the face of VBAC for our entire health authority. We were basically showcasing her story to show that, you know what, you really need to be able to advocate for yourself. And when Wendy did this, this is when I recognized that moms who want to have a natural birth after multiple cesareans often get told they don't even have that option. And this is where a lot of my clients came from. Rebecca was my first VBAC mom who actually ended up having a home birth after cesarean. Lisa had had 2 C-sections too, and she didn't want another one. And we were basically teaching her how to take her power back. Now, Lisa's story, she ended up getting another C-section, not because she needed it, but because she was bullied into it by certain people in the medical system. But she could at least see what was going on. She just didn't have that right support of her partner. That is how I know that the partner is the wild card. That's why the empowered birth method has 5 pillars. You need that right mindset, that right education, the right environment, the right facilitators, and the right support. And that right support is crucial for advocating, because Lisa couldn't exactly advocate for herself while she was trying to push her baby out. So the fact is that you really need to know you can have an attempt at a VBAC. You're either going to have a VBAC or you're going to decide that it's time to call in the C-section. And it gets to be your choice, not something that's pushed on you. The empowered birth movement exists because I am sick and tired of moms who have had multiple C-sections being told that they absolutely have to have another C-section. These moms are desperate to avoid it, and they start looking into having unassisted free births to try to avoid it. But they don't really want to give birth unassisted. That is what they're choosing to do only because they're backed into a corner. We need to shift this around. We need to be able to have moms stand in their power and be able to birth unassisted in the hospital so they can still have that hospital backup if they need it. Because, there are risks to giving birth after cesarean. There's risks to giving birth even if you haven't had a cesarean. But the fact is that we don't deserve to be pushed into a corner just because the medical system isn't comfortable with us having our bodies work for us instead of being cut open. It's not okay. So here at Empowering Moms, this is why information is free and I only charge for access to me. Now, I did do an older video where I had basically talked about having a VBAC after 3 cesareans. You can go and check that out. If the transcript is available, I've just linked it to you. And if it's not, you can go and check out the VBAC playlist because that will help you. I also have resources if you go to my website, empoweringmomsbirth.com/start guide, and go into the section on VBAC, and you will get additional resources to help you plan and get your VBAC even after multiple C-sections. Because no, you are not stuck. No, once a cesarean is not always a cesarean. Your body can adjust, your body can heal, and your body is designed to birth. Number 17 on our list is something that moms often don't see. And this is when you go into labor on a weekend or a long weekend, a holiday. I call these times of year induction season. And the reason for that is because often this is when inductions are pushed. You are also more likely to get pushed into a C-section if they want you to deliver by 5 o'clock or if they want you to deliver by the weekend. So if you go into labor on a Friday, be more aware of the traps that you could fall into. Stay away from the hospital until the last possible minute, because if you go into the hospital, then you are more likely to get pushed through the system, especially if people want to be able to go home early on the weekends or to schedule their vacation. Doctors that are category 5 are notorious for suddenly deciding to induce you before they go on their vacation to ensure that you are still with them and they get paid for your birth. And they get paid a lot of money for your C-section. So you really do need to be careful. Babies don't have a calendar. They don't really care if it's the long weekend. But if you are giving birth around the time of these induction seasons and cesarean seasons, be more aware of what's going on. Because yes, there is a correlation between certain days and certain times of the year and the rising C-section rates. Number 18, vaginal exams. Well, if you don't go to the hospital until the last possible minute, you won't have to worry about this. But if you are having vaginal exams, this can introduce infection. This can also lead to your cervix reversing dilation, which then gives you the failure to progress label. Vaginal exams also freaking hurt. I don't care what people say about how it's just a little bit uncomfortable. No, they can freaking hurt. Go check out one of my other videos where I talk about vaginal exams as a natural birth trap. Because the fact is that you don't need to have a single vaginal exam to have a natural birth or to have a VBAC. And the more they do these vaginal exams, the more likely they're going to label you failure to progress. And you're not dilating 1 centimeter per hour. And guess what they are going to do? Exactly. Stay away from it. Number 18, induction. I have talked about this, but if you are a first-time mom, did you know that you are actually 3 times more likely to end up having a C-section if you induce your labor? The fact is that induction comes with the risk of C-section. And we can pretend all we want that induction doesn't do this, but there is a lot of evidence that it does. And if you're only comparing natural birth as perpetuated by the medical system to the inductions, then you're not getting the full story. You need to compare physiological birth and spontaneous labor to the actual inductions. And the thing is that moms who want to have physiological births and avoid the induction are not going to opt into those randomized controlled trial studies. They're going to be like, you think I'm going to do that? I'm not falling for that. I'm not going to have you mess with my birth just so that you can get some data. No way. So the fact is that we can't get accurate evidence and research on that. And what I'm going to suggest is you check out Hensi Goer's book, which is called Labor Induction, Why, When, and How. Another good one is Rachel Reed's book, Why Induction Matters. And finally, In Your Own Time by Dr. Sarah Wickham. These 3 books are the biggest resources that I have on induction. They're the ones that I highly, highly recommend to all of my clients. And these are the ones I talk about a lot inside of my videos on induction. Induction in itself is a trap, and there will be an induction traps series in the future. So stay tuned for that. Because the other thing with induction is number 20, you're more likely to want the epidural. The epidural in itself can also lead to a C-section. The reason is because, again, you are getting medication that you don't know how your body is going to react. You don't know how your body is going to be able to handle it or your baby. You could have things go wrong with the epidural. There are risks to this. You could end up having your blood pressure severely drop. You could end up having complications with the epidural. You could also end up not being able to effectively push your baby out, or your baby could get stuck. This is not a foolproof process. So when you are planning to get the epidural, you really do need to go in with your eyes wide open. Again, Hensi Goer has a book. It's called Labor Pain, and you can go and check that one out. She does go into the risks and benefits of the epidural. So that is what I would highly suggest you do if you are considering the epidural. But with a physiological birth, you are less likely to need the epidural, because with a physiological birth, there is less likely to be that much pain. But with Pitocin and induction, that's usually when moms are like, get me the epidural. And finally, number 21, the cultural narrative that you cannot birth your baby on your own. You know, the thing is that if you think that you have to birth with somebody outside of you telling you what to do, then this reinforces the idea that you're not allowed to go past your due date. You're not allowed to give birth naturally. You're not allowed to have a VBAC. You're not allowed to have a home birth. And the more that you think that you're not allowed, the more you are going to defer to the experts and think that you have no options. The more that you think you have no options, the more they are in control. And the more they're in control, guess what? You're more likely to get pushed into that unnecessary C-section that you don't actually need. And this is why when my clients are working with me, we're focused on taking our power back. No permission needed. Dee Dee did not ask permission to have a VBAC. She went into that hospital and she said, I am not having a C-section. The fact that I actually chose to go almost unassisted is because you wouldn't let me birth naturally, and I do not want this C-section. So now I am choosing to come to you for a little bit of help, but I am not consenting to major abdominal surgery until I feel that it's necessary. And they were able to then be like, okay, she's really serious about this. Maybe what we were doing before was the problem. She almost risked herself and her baby to get away from us because of the fact that we were so relentless in our pursuit of trying to get her into the hospital to have this C-section that she clearly didn't want. When moms go to those extremes, and they shouldn't have to, but when they do, it shows the mirror of the system. If more moms stand in their power, the more that's going to shift the market. Because remember, if you want to change something, you need to have the consumer base aware. That is, again, why the empowered birth method exists. That's why the empowered birth movement exists. That's why these master classes exist, because information is free and I only charge for access to me. And I'm committed to every mom getting the birth that she wants without having to fight, beg, or compromise. Because we have to stop playing the game if we want to be able to take our power back. If we want to be able to birth naturally and avoid the C-section, we have to take our power back. We can't keep deferring to the system. We can't keep asking for permission, and we can't keep playing the game the way they want it to be played. Because when you do that, you end up falling into the cesarean traps and the natural birth traps and the induction traps. You just fall into fear, and you need to come to your birth from a place of power instead of a place of fear. So again, that's pretty much the list. And if you want a copy of your own, all you have to do is go to my website, empoweringmomsbirth.com/freebies. Next week, we're going to actually dive into each one of these cesarean traps. So stay tuned because we're going to start with number 1, the big baby, and then we're going to go off from there. So until February, we are going to be going into these cesarean traps. This is season 3 of the Empowered Birth series, where I go deep into everything you need to know to plan and get your empowered, true natural birth. And if you found value in this, please like, share, subscribe to our channel, pay it forward, pass this on to other moms in the mom groups, because a drop in the ocean creates ripples, many ripples create waves, and enough waves can change the tide. And here at Empowering Moms, I'm all about changing the tide. So thank you so much for watching. Have a happy empowered birth journey. Whether you're birthing a baby, birthing a business or a creative project or a movement, or rebirthing a new version of yourself, Empowering Moms is here for you. And you can always check out more of our resources at empoweringmomsbirth.com/start guide. So thank you again, and I will see you soon. Namaste.